Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Prolonged block after succinylcholine. The prolonged block after succinylcholine includes prolonged block after succinylcholine occur. In some cases, there is prolonged block after succinylcholine. It occurs due to three main reasons. One, low pseudocholinesterase. Two, atypical pseudocholinesterase. Three, phase 2 block. One, low pseudocholinesterase. So the causes for low pseudocholinesterase is whenever there is liver failure or hypoproteinemia, or if the patient has cholinesterase inhibitors like neostigmine and pyridostigmine. So in all these cases, there is low pseudocholinesterase. Okay, so treatment of this low pseudocholinesterase is to continue the positive pressure ventilation and to wait for spontaneous recovery. If the patient recovers, it is well and good. If the patient cannot recover, then we should give synthetic pseudocholinesterase followed by fresh frozen plasma. Second, if atypical pseudocholinesterase. If the patient has atypical pseudocholinesterase, it can be due to a genetic cause. This atypical pseudocholinesterase is diagnosed with the help of a D-Buchan number. The normal D-Buchan number is 80, whereas if the atypical pseudocholinesterase is homozygous and if it is atypical. In homozygous atypical pseudocholinesterase, the D-Buchan number will be 20, and in heterozygous atypical pseudocholinesterase, the D-Buchan number will be 50 to 60. Treatment of atypical pseudocholinesterase is almost same as low pseudocholinesterase. Then phase 2 block can also be seen. Phase 2 block or dual block. In phase 2 block or dual block, there is high dose of succinylcholine, and the pathophysiology of the succinylcholine in phase 2 block is not known. Here, the fading which is seen is diagnostic in phase 2 block. Treatment of phase 2 block is to continue intermittent positive pressure ventilation for 30 minutes, and in 50% of the patients will recover. If the patient do not recover, then it is neostigmine. Non Summary: prolonged blockade after succinylcholine. 1. Low pseudocholinesterase. The causes of low pseudocholinesterase are liver failure, hypoproteinemia, and cholinesterase inhibitors like neostigmine and pyridostigmine. Treatment is to continue positive pressure ventilation and to wait for spontaneous recovery. If he recovers, it is good. If he cannot recover, then we give synthetic pseudocholinesterase along with fresh frozen plasma. Atypical pseudocholinesterase is a genetic disease which is diagnosed by D-Buchan number. Normally it is 80. In homozygous state it is 20, whereas in heterozygous state the D-Buchan number is 50 to 60. The treatment is same as low pseudocholinesterase. Then in phase 2 blockade, it is given, this is seen in high dose of succinylcholine, and the pathophysiology of phase 2 blockade is unknown, and diagnosis is mainly by fading, which is diagnostic. Treatment is intermittent positive pressure ventilation for 30 minutes, and 50% of them will recover. If they do not recover, then it is neostigmine should be given to the patient.
thank you and thank you for watching.